Good evening, everyone, and welcome to Pull Up with Limbs and Things. I'm Dr. Chanel James. I'm the owner of Limbs and Things Mobile and Telehealth Physical Therapy Practice. We serve aging adults in DC and Maryland and in Virginia, helping you move from I can't to I can. Tonight on Pull Up with Limbs and Things, we're talking to Mr. Bryan Ellison. He's a
Hello.
radiologic technologist. Welcome, Mr. Ellison. How are you?
I'm doing well, Chanel. How are you doing today?
I'm good. I'm glad to have you here. There are a lot of times that I see patients who have a need to go and see a person who does all of these x-rays, MRIs, CT scans, PET scans, all of the different imaging types. And they're just wondering what is it that they're really looking at when they do those different tests.
hmm
And if they have to do a particular position, like they'll let me know, like, do you think I can do this? Do you think I can get on the table and really handle this without having to have someone there? So
Yeah.
let's talk about that a little bit.
Okay. Well, they say I'm Bryan Ellison. I'm a I, I'm thinking right there. I was talking to my wife earlier. Who is that? I am a radiologic technologist, and I have a specialty in CT, or as most of us know as CAT scan. But yeah, so we're talking about imaging and different types of imaging and stuff like that. So in general, you have radiography, which is what most folks know as X-rays. You
Mm-hmm.
go in, put your arm like this, you lay on a table, you stand up to the board, stuff like that. And then you have more specialized imaging like CT scan and ultrasound, MRI, and stuff like that that require mostly laying down most of the special imaging, nuke med scans and stuff like that. You're not standing up for that, which is good because they take a little bit more time and they may be breath holding involved, which is easy to do it laying on your back when you're comfortable, as
Mm-hmm.
opposed to standing up and holding your breath for like 30 seconds, 15 seconds. Might not be that comfortable.
Yeah, that can be hard for some people.
It can be, especially older patients. And I know that's what you primarily deal with, who may
Right.
have like COPD or emphysema or breathing problems, such. It's not always easy holding your breath for a long time, especially when you're like standing up, kind of moving around. Being laying down and comfortable makes it a little bit more tolerable for most
Mm-hmm.
patients, especially our older population.
Okay. So let's talk about how you should possibly prepare for having, say, an MRI.
Okay, so I am not an MRI tech, but I did a lot of training MRI as a student. I know a lot of MRI technology, so I can give you a general overview.
Okay.
Most of the times, if it's with contrast, and I'm gonna just say that general terms with contrast, you may be told not to eat for a couple hours prior to having your testing done, just so you don't get nauseous or anything like that.
Mm-hmm.
You want to make sure you show up, uh, let's say about 30 to 45 minutes early. With MRIs, we do have something called safety screens because it involves magnetic fields, which a lot of older patients may have had surgery or implants or like cardiac cath
Mm-hmm.
leads and stuff like that. So we got to make sure that you will be able to go in the MRI. So we don't want to cause any problems with your implants or surgical screws or anything.
Right.
And B, you may be able to bring a family member. And kind of depending on if they have any metal implants, they may be able to go into the exam room with you. So that's
Okay. So if you have a total knee replacement, a total hip replacement, shoulder
no,
replacement, can you have an MRI?
no. Now, from what I do understand, there are some metal implants now that are MRI acceptable. I don't think there are very many of them, but for the most part, no. You cannot go in there with most metals or implants because
Gotcha.
it might not be very fun for you.
Got it. Okay, so if you're watching and you have a question or a comment, please put it in the comment section and we'll read it. We'll talk about it and make sure that we answer your question. As always, pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to be able to share that information with someone else. So, so before the exam, that was all about MRIs. Is there anything that we need to know differently for, say, an X-ray or for a PET scan or a CT scan?
Okay, so we can kind of talk about each one, like the
Okay.
pre-prep. For the most part, X-rays, like general X-rays, like your knee, your back, your leg, or your arm, something like that. There's no pre-patient prep for most of those. You just kind of show up, you sign in, they get you to where you need to go and do whatever. For more specialized exams, like CT, you may have to withhold food for a couple hours prior. If we're giving contrast. If we're not, then just kind of show up and do your thing. With ultrasounds, there may be some withholding food and drinking plenty of water before your scans. With nuclear medicine and stuff like that, they also will probably have a dietary restriction the day prior or a few hours prior to the exam. So make sure that, also medications. There are some tests we do where you have to withhold medications, CAT scans sometimes, nuclear medicine scans sometimes. It depends on what you're taking that medicine for. Like for instance, if you were doing a nuclear medicine scan with like your heart, like a stress test, which I know a lot of older patients do have those stress tests a lot. You probably get those questions about that. If you take cardiac medication, you may not be able to take that because it may affect the test or anything like that, or a certain food. So as always, you're going to have an exam. Make sure you ask your doctor, what do I need to do or not do the day before or hours leading up to the test. And most radiology departments are pretty good about sending information with like a checkoff list. Make sure you have this, do not do that, so that they can get you in on time and then make sure your test is successful and then get you out on time.
Gotcha. Now you talked about contrast, but so that everybody is clear, what's the difference between contrast and non-contrast?
Okay, so in general terms, a non-contrast, I'm gonna say CT is like my specialty. Okay. We'll look at your body part or the inside of your body, whatever, and we'll see for the most part your internal organs. We'll see some veins, we'll see some arteries or that, but we don't really see the blood flow with that much detail. With the contrast, which is generally administered through an IV and some by mouth, it enhances the function of those blood vessels. So we can see if you have diminishing blood supply to a certain area. We can see if you have blood clots. We can see if your stomach is emptying as it's supposed to. We can see the general physiology of what organ we're looking at, make sure it's doing what it's supposed to be doing. Contrast is different depending on what exam you're having done. With CT, we have something called iodine-based contrast, which is for the most part okay. There are some people with some allergies to it, so you want to make sure you're not allergic to iodine before you have a CAT scan with contrast. But for the most part, most people do okay. In MRI, they have something called gadolinium. It does the generally same function, but it's made from a different substance. Okay. And in nuclear medicine, we have multiple contrast agents, which is we can talk about that in more detail if you like. Yeah. Okay.
You can.
Okay, go ahead. So with nuclear medicine, we have stuff called tracers, which is radioisotopes. So I'm trying to keep it as general as I can because we learn about stuff in school, and I don't want to make my head pop off and scare me out. Basically, there are certain the cellular level of like an organ we're looking at. Let's say for a nuke med study, we're looking at your bones, right? We want to make sure you don't have bone cancer or anything like that. They can develop a isotope that's used for your test that interacts with your bones. And when you have your scan, the camera can pick up on that specific isotope to see if your body is absorbing it where it needs to absorb it. And we can tell from that if like you have osteomyelitis or some type of bone cancer, or if it's spreading or whatever like that. So contrast in general just aids in diagnosing whatever problem you may or may not have.
Right. So contrast just helps you to see better. Right.
I'm sorry. Yeah, I went way off the cornfield, as we say back in
It's okay. But that was good. I didn't know the all of the specific agents that you can use. Now, is it invasive that you have to use, or is it something edible you can drink?
We, like I said, we do have IV contrast, so I guess that'll be more invasive. We have oral contrast, which is by mouth. Usually, we will have you drink it, or it can be put in like a food substance like yogurt or something that you eat, and then we track it that way. And we do have contrast that is administered rectally. Now we don't do that as often anymore,
Mm-hmm.
but every now and then, an old school radiologist will probably want to us to do what we got to do.
Got it. Interesting. Okay. So, is there anything that we should know during an exam? Like if you are needing to get on a table, specifically those who are or have a little claustrophobia about, say, getting into a closed MRI.
Yeah.
What should you know during the exam?
All right. So if you're claustrophobic and you already know this, my first advice to you would be to tell your doctor if they order an MRI, whether it be open, closed, or a CAT scan or whatever it is. If you already know you're claustrophobic, please let them know. They can give certain medications by mouth that can make you relax a little bit, right?
Mm-hmm.
So that'll help. Tell the technologist the day that you're having your test, hey, I'm claustrophobic, I don't like tight spaces. And we can do whatever we can to try to make sure that we can make you comfortable with the test and then like to follow through with it. Because some people, they can't do it. They
Right.
can't go in there. I've had patients that will try to climb out of the
Oh
machine.
no.
Yeah. And then there's some patients I've had where if you just give them a little bit more time, kind of explain everything to them what's going to happen, and then you can talk to you during the exam, they can tolerate it. So each person is different, but let somebody know. Don't pull a fast one on us, because that could hurt yourself or the technologist. But yeah, this
Absolutely.
let us know prior to, because we can do stuff for you. We can give you comfort measures like wedges on your knees or stuff like that. We
Mm-hmm.
can talk to you during the exam for most tests to kind of keep you under that level of anxiety that makes it difficult for you to do what you got to do.
Okay. Now,
Mhm.
are there any things that are accessible for someone who, say, even has difficulty getting on those higher tables if they are needing to lay flat?
Yes, ma'am. So most exam tables do go down to the
Mhm.
floor. Well, not to the floor, but within like maybe 2 feet from the floor. And for most
Okay.
people, that's able to kind of sit down, even
Mhm.
with help. We also have like the little steps we can bring to the machine if it's some that don't come down, and
Okay.
it's like little movable steps. You just kind of walk up and get to where you're going. So yeah, we can bring little aids to help you get to where you need to go if need be.
Okay.
Also, we can help you transfer from a laying position, like the slings that you
Hmm.
can have attached to your ceiling tracks in your rooms.
Yes.
We have a lot of patients. Well, I work in the VA, so a lot of our patients come in with a wheelchair and they may not be able to stand or pull themselves up without too much strain. So
Hmm.
we can put a sling underneath them and kind of hoist them up to put them onto the table.
Okay.
Mhm.
Good to know.
Yeah.
Okay. What about after the exam? There's always the person that says, "Well, what did you see?"
Ooh, I tell you what, if I ever become an MD, I'll be more than happy to tell you. But as a technologist,
Uh huh.
we are not legally permitted to say what we see. It's outside of our scope of practice.
Okay.
I think the problem with that is we go through a lot of education. We know a lot of anatomy, physiology, pathology, and
Hmm.
most of the times we know what we're seeing. We have to know to make sure your test was successful, but we can't say anything. And because we're there with you, I guess you kind of build that rapport. They want to say, "Hey, what did you see? Did you see
Right.
this? Do I have that?" We can't say anything, guys. I'm sorry. I am so sorry to let y'all down, but no, we can't do it. We like to keep our license and our paychecks if possible.
I understand. Okay. So, caveat: physical therapists have similar scopes of practice as well in terms of not being able to tell you like a medical diagnosis, even if we have an inkling based on your symptoms. However, if you've had imaging done, you've gotten the clinical impression of that imaging, and you
Mhm.
still don't understand it, you can come to a physical therapist and we can interpret it for you, and give you the layman's terms of what's being seen on those pictures.
Oh,
Imaging is something that we do cover, and so we're able to identify each one. So in an MRI and an X-ray and a CT scan, we can tell you a little bit about some of the things that you're reading about if it's not clear to you in the write-up.
yeah. When a radiologist reads, oh, they interpret your exam. of course, they're using all of the medical lingo. So most people don't know what some of those things are. So I can imagine it's really helpful if you guys come in and kind of break it down for them.
Yeah.
Because you can to a degree in that sense.
Absolutely.
We are not able.
Okay, so there are times when we get imaging, but then we want the CD. Yeah. We want access to be able to see it and send it to whomever we desire for additional healthcare needs. How will we go about doing that?
Most departments have some type of form to fill out, where it pretty much, in general terms, you explain who you are and you tell them what test you had done, and you want to say, like, I want this exam I just had done sent to my doctor, and you fill out a form saying we have your permission to do so, because most of the times we can't give you the information strictly for you, because I know it doesn't sound right, but the information belongs to the hospital, even though it's technically your imaging. But we can't send to your doctor for aiding in your diagnosis or whatever like that. But most time you'll have a clerk or whatever, a technologist, tell you what ways to go through to get that information. Because we want you to have it if you need it, but we can't just give it out. We don't want that to get that to the wrong hands, and then your information's out there, and then we're violating HIPAA, and it's a whole thing that we got to go through. But let's go through.
Everybody has to protect themselves.
You are right.
Right. So we see that you're watching, but we can't actually see who's watching. So if you're watching live, please comment or hashtag live. If you're catching this on a replay, you can hashtag replay. Again, if you have any questions or comments for Mr. Ellison, you can put that in the comment section and we'll go over it. Is there anything in particular, say for an aging adult who is worried about coming to have a particular imaging done and they want to bring somebody with them? Is there anything in particular that person should do?
Well, let's speak with this outside of the parameter of COVID, because obviously COVID has changed a lot of how we let people in and out of hospital. So
absolutely,
assuming there's no COVID, then yes, you can bring a family member with you or someone can drive you. Now, certain exams won't allow a family member to be in the room without like some kind of authority or whatever like that, because we may be using radiation, and we don't want people who don't need the radiation to get the radiation, unless, of course, they're okay with what's going on with that. But yes, we can have for certain tests, X-rays, they can be in close proximity, but maybe not in the room. A lot of times we allow patients to have someone in the room if they have a mental health need, to where it's better for the exam to be done with someone in the room. So there is that exception. Children, which obviously we're not talking about children in your practice, but we can have parents in the room for that. MRIs should be fairly okay, assuming that they don't have any metal implants or anything like that, which they need. You can have your guests in the room for that. Nuclear medicine, not so much because of what we're doing there. They could be in close proximity, but maybe not right next to you. But always ask the imaging department before you go, can I bring XYZ person with me? And they'll give you the protocols for that individual facility on what they require for patients to have guests with them in the room.
Got it. Yes. Are there any things that you want to say specifically to someone who is possibly on the fence about if they should have a type of imaging test because they're concerned about how much radiation they might receive?
That's funny. We get that quite a bit, actually. So if you're wondering about how much radiation you've had in the past, we have a lot of patients that say, hey, I've had a lot of x-rays. Does that add up? And the general answer is, over a period of time, no. In a short period of time, yes. And let's say if you had one x-ray every day for 20 days, that's a lot of radiation. Don't want to keep doing it if you don't have to. But if you had an x-ray every other month for a year, that may not be so bad. That kind of also depends on what the doctor is diagnosing you with or tracking. There are some people who do have a lot of exams that use radiation or ultrasound or MRI, whatever like that. It's kind of based on like they have cancer or some kind of chronic pathology that we are tracking over time. You may have to have a lot of imaging services, and I want you to just know that no one's doing it because they can. We're doing it because we must, to make sure that we get you in a better position.
Got it.
I would hope that most physicians are explaining to their patients like why we're doing what we're doing. That also helps, because if you don't know why the doctor keeps ordering something, you want to make sure you ask. Is it
Absolutely.
necessary, or can we do something other than a CT? Can we do an MRI if you're able to, or an ultrasound, depending on what the pathology they're trying to diagnose or whatnot like that. So make sure to ask questions. That's like your biggest
Absolutely.
advocate, asking questions.
Yeah. And we have a few that I am just seeing. Okay, so what schooling do you need for your profession?
Okay. So I went to a technical college.
Mm-hmm.
You can go to a 4-year school if they have the program for radiologic technology or radiologic sciences.
Mm-hmm.
But most of the time, you're going to end up in the same general place as we're going to a technical school or a junior college. So financially, do what's best for you. But at minimum, you can go to a good tech school. You'll be just fine.
Okay. And how many years is that program?
You'll go through your prereqs, just like most other things, and then you'll go through about 1 or 2 years. Well, when I went, it was 2 years. I think they kind of bumped down to 1.5 now. But
Okay.
generally, 2 years of specific radiology courses, and most programs don't have any breaks. So you may have like a week between semesters, but you don't get like a summer break or winter break or anything,
Mm-hmm.
which that will include in classroom work and clinicals. And you will do a lot of clinicals because they want to make sure that you know what you're doing before you go out into that work world. You know what I'm saying?
Absolutely.
Mm-hmm.
Yeah, that sounds a lot like PT when you don't get those breaks.
Ooh, I heard about y'all's program. Boy, that is rough.
Yeah. Another question for you. How can the radiology department own your images?
Well, technically, we don't own your images. The hospital owns the
Mhm.
images. Now, of course, we are the ones who take the images and we put into our archiving system to where we can access those if we need to. The doctor can access them, your physician can access them. But
Mhm.
we don't, as technology, we don't own your images. The hospital does to a degree.
Gotcha. Okay. I think we should back up and talk about basics. So X-rays, look at bones, right? We see
Okay.
them more clearly, right? What do we see with CTs, MRIs, PET scans?
Okay. So with CT, we look at bones in really good detail.
Mm-hmm.
We look at what we call soft tissue structures like your brain, your heart, your blood vessels, your kidneys, and stuff like that. We
Mm-hmm.
can diagnose most pathology with a CAT scan, but we use radiation. With MRIs, they are a bit more sensitive to more soft tissue stuff, so we can see like your ligaments and tendons, which I know would be kind of really good in your field in PT.
Yeah.
That we can't see like ligaments, tendons with CT. It's not that sensitive.
Mm-hmm.
With nuclear medicine, we're looking more at the cellular level of diagnosis, like cancer. What makes up a particular cancer? How does it function? They can look at bones and stuff as well, but it doesn't give as much detail on the actual picture aspect as
Mm-hmm.
opposed to how it is functioning aspect.
Okay.
So it kind of depends on what your doctor is looking for. Like for example, let's say a patient comes to you with a rotator cuff injury, right? Assuming they don't have any metal implants that can't be removed, all right,
Mm-hmm.
and they'll probably want to have the MRI be at the gold standard because they can see those ligaments and tendons connecting that
Right.
CT can't see, all right, as opposed to someone who may have appendicitis, all right. CT gives you real good information on that in a fairly quick manner. So we can get you that acute information really quick. With MRI, it takes a bit more time for certain things. So you probably don't want to wait 3 hours for the MRI to be done as opposed to a CAT scan, which could take 5 to 6 minutes.
That's good to know. Timing is definitely important in terms of if we're thinking about positioning, how long you have to stay there.
Yeah. I guess the fact we're talking about our aging population, time is probably for them the number one thing because they got stuff to do,
Yeah.
and laying those tables are not always very comfortable, and you want to go for the quickest thing. So with CT and MRI, we do have wedges or pillows we can use to try to make you comfortable for the most part. Now, I will not say that we'll have it feeling like a certain mattress. That's often not going to be where you're going to end up. But we can do things to make you feel a bit more comfortable.
Mm-hmm.
Example: if you have lower back problems, we can put a wedge underneath your knees to kind of prop your knees up, straighten out your spine. What makes it a little bit more tolerable for like CAT scans or whatever. For MRIs, they have some of the same things along with their coils, which they use those for imaging, but they can put little wedge pillows in there that make it, not feel so cold and not so hard. Because a lot
Mm-hmm.
of medical equipment is not made necessarily for comfort. A
Absolutely.
lot of flat, hard surfaces. So
Yeah.
yeah, we will try to make it as comfortable as we can, as quick as we can. If you're worried about certain things, again, ask your doctor. How long will this take?
Mm-hmm.
Do I need to take, like a muscle relaxer prior to for some patients, or not do PT that day before I go? Because you don't want to wear yourself out and then go have an exam where you got to hold real still on an uncomfortable surface for a while. So ask your doctor beforehand, how long will this test take? And then you guys can make that decision. Can I physically do it? Because we want you to be able to. We don't want to get you there and then find you can't do it. We don't want to waste anybody's time in that sense.
Got it.
Mhm.
Okay. Well, I think that's all the questions I see over here. If you are watching and you have a question that you want answered, please make sure you put it in the comments and we'll answer them. While Mr. Ellison gives us his final thought about anything that he's talked about thus far, or anything that he thinks is really important for an aging adult or an aging adult's family member to know prior to having an imaging done, during, or after.
Okay, so if I had to leave one final thought, I would say, as I said most times today, make sure you ask the questions. You can't know, and I wouldn't suggest you go on Yahoo, Google, and YouTube to get all your medical information. Don't do that. Ask your doctor.
Don't do that.
Don't go
Yeah.
to WebMD for everything. Ask
Mhm.
your doctor, what are we doing? Why are we doing it? How will it help in like either the diagnosis or treatment? Like I said, can I have my family member, whoever come with me?
Mhm.
Uh, ask your doctor, ask the technologist. Call ahead if you need to. We get plenty of patients who call. They say, "Hey, I have an exam for this day. I have this test done, and I have these questions." Please do so because we are there to help you. Because we want you to be able to come to get your exam done in a comfortable as we can make it manner, and B, make sure your test is diagnostic because it won't be worth your time to come and we can't get you a good test. So
Mhm.
make sure you ask all the questions that you need to ask so we can give you all the information you need to make a good decision for you because everyone is different. So you need to know what you can do and if you're willing to actually do it.
Absolutely.
Mhm.
I agree. I think those were really good points. And to the end of positioning and timing and making sure that you are fully prepared before you go. And then after you leave, being able to know that you can request to see that imaging from the your physician's office after they have given their clinical
Mhm.
impressions. And then being able to know that you can ask your physical therapist if you still don't understand what's being written on that paper.
That is new
Yeah.
to me. I didn't know that. That's pretty interesting.
Yep.
That's pretty interesting.
Uh-huh. So
Mhm.
we can help answer some of your questions and being able to put all the pieces together so that you are fully aware of what's being seen inside of your body. And so you can make the necessary changes because it's all about making sure you live the best possible quality of life you have.
Yeah, there you go.
Yeah. So I want to thank you so much for joining. You shared a lot of information that is
Thank you.
helpful to us, and I appreciate your coming. This is our last pull up with Limbs and Things for the year 2021. I've enjoyed sharing these with you. I thank you guys for joining and watching. Hopefully, you've gotten something beneficial from them. and we'll be back next year. All right. Take care. Everybody have a good evening.
Bye.
Oh, and happy holidays. Merry Christmas.
Same to you. Same
All
to you.
right.
I
Take
hope it's a
care.
good one.
You too.
Hmm.
Take care.
Bye.
Bye.